Dr. Alexey Nazem is not only a doctor, but he's also an MBA. And what was that? He studied molecular biophysics and biochemistry as an undergrad. He's a very wide-ranging person, but he's basically now started the first online marketplace for doctors and nurses. So he's going to tell you a little bit about it, and then I'm going to join him back on stage. We'll talk about it for a second or two.
Thanks, David.
Thanks so much.
Good morning, everybody. Thanks for inviting me to speak to you today. My name is Alexey Nazem, as David said. I'm the co-founder and CEO of Nomad Health, the very first online marketplace for healthcare jobs. And I'm here to talk to you today about a slow motion crisis that's happening right now in the United States. So every day, 10,000 Americans turn 65 years old. And Americans over the age of 65 require 3 times as much health care as those under the age of 65. And naturally, this is putting a huge amount of pressure on our medical system. In fact, it's estimated by the Association of American Medical College, who makes these kinds of estimates, that we will have a shortfall of about 105,000 physicians in the next few years. For context, we only have 800,000 physicians in the United States now. So we're talking about a 13+% shortfall of physicians. This is a problem that has existed for decades, but it's only getting worse because of demographic trends like the one that I talked about, medical trends like some of the ones that were talked about on the panel before, and a few other secular trends. But this problem has grown in magnitude and cost over the last several decades. The way that the problem has been traditionally solved is with temporary medical staff, so short-term doctors, short-term nurses, and other medical professionals. In fact, the problem has gotten so large that we spend about $15 billion every year on hiring temporary staff. Unfortunately, the system for hiring these kinds of clinicians is hopelessly broken. It is stuck in the 20th century. It is a system that relies exclusively on brokers. Every transaction needs to go through a third party. And as we know, brokers are expensive, they're inefficient, and they're terribly opaque. So if you look at a typical transaction, you start to see how expensive this situation is. We don't have to look at the numbers except to say that the American medical system is getting fleeced by brokers. Agencies take on average a 40% commission to hire a doctor for a short-term period, and sometimes as high as 70%. The process itself is also really, really cumbersome and frustrating. Myself, I did a locum tenens job. It took me 10 months to organize a 3-day job. And that whole process involved, dozens and dozens of pages of paper that I had to fax in, and it was a very frustrating process, which I'll be not too delighted to tell you about off stage afterwards. But suffice to say, the tools of the trade are pen, paper, telephone, and fax machine. It's also a very opaque system. So the two sides of the transaction, the clinician and the healthcare facility that wants to hire them, are contractually prohibited from telling each other what one is paying and the other is receiving. This is not how other marketplaces work. This is not how you buy anything in the world, but this is how you buy healthcare services, one of the most important things in our economy. So we thought that there had to be a better way, and that's why we built Nomad. Nomad is a recruiting system built for the 21st century. Everything happens online in a seamless, effective, and efficient way. Hospitals can post beautiful jobs in a snap. Doctors can post profiles with comprehensive information about themselves. That's me, although not my actual information. And our smart algorithms help match doctors with the right jobs and healthcare facilities with the right doctors. They can message with each other transparently, directly, without going through a broker. When they find each other, whoops, went to the end of the presentation here. Okay, well, we don't have the rest of the slides, but I'll tell you what they said, which was that, so once they find each other and they want to link up, everything else happens online. So all the contracting is done electronically. Malpractice insurance is issued electronically and immediately. Background checking and credentialing is done online. Payments are made electronically. The entire process happens magically through technology. And as a result, it's substantially less expensive. It's 3 to 5 times less expensive to hire doctors through Nomad than through a traditional staffing agency. And by the way, you end up getting better hires because you're having direct communication. There's no game of telephone with a third-party broker. Already thousands of doctors and hundreds of healthcare facilities are using Nomad to hire doctors, and that's just the beginning. We have big ambitions as a company. There are similarly difficult shortage problems in other clinical verticals, so for nurses, nurse practitioners, physicians assistants, and other types of clinicians. So we are really excited about our opportunity to grow here. We are obsessed about improving the quality of care that gets to the bedside and doing it in a very cost-effective way. So thanks for your attention, and look forward to some questions.
Yeah, so given you're doing this, and given that you are a doctor who's also an MBA, and given the discussion we just had, what do you look at this big picture question of how tech can transform or not transform American healthcare and ultimately global healthcare? What's your macro view on that?
Sure. It's a big question. I think that technology has a big role to play here in healthcare. I think there are multiple layers. I mean, the first thing is something like what we're doing, which is really addressing some of the efficiency problems in healthcare. So some base layer stuff, making sure that things that already happen in a more effective way and also a more cost-efficient way. But then there's also this opportunity, like was discussed on the panel before, to create force multiplication of the existing resources that we have. So things like telemedicine allow doctors to see more patients than they already see. And then layer on top of that, the ability to, I know it was discussed with a little bit of skepticism, but the idea of eliminating some human elements of care for diagnosis and treatment for some conditions. So I do think technology has a huge role to play here. I mean, simply put, medicine is an information business, and technology is really good at gathering, storing, and disseminating information. So the two really should be married. We just haven't figured out a good way to do it yet.
So this startup that you're doing is just one way that obviously you've been thinking about these efficiencies, and you see a lot of others. But it is interesting that, we think of the on-demand economy, the sharing economy, all the miscellaneous words that are applied to it as typically involving, relatively low-paid work, but what Nomad is showing is that same mindset can be applied at the highest end of the economy, because these are high-paid positions.
Yeah, and not only can it be, but really we should be thinking about this stuff. These are resources, doctors, nurses, that we've invested an extraordinary amount of money in as a society to train. And so these are highly paid resources that are not being, or highly valuable resources that are not being used to their fullest extent. And so with a system like ours, we have the opportunity to take advantage of what we've already invested in.
So there's an incumbent ecosystem of staffing agencies that take that $20,000 in your slide, right? Mm-hmm. So are they trying to keep you out?
I'm sure eventually they will. I think ultimately everyone in this business is invested in the idea of getting good patient care to the bedside. So, I think these competitors will understand that this is an opportunity, not a threat. And so hopefully we'll be able to partner rather than fight.
Anybody have a question or a comment? Please.
I have a question. Thanks for the presentation.
Sure.
There's a mic coming. If you just wait 1 second. Thank you. Great.
Kange Kanene, I work at SAP. I understand what you're saying when you're trying to do help temporary work come into the situation. That makes sense. But at the beginning, you talked about how there's this gap of 105 positions that are not available because of the aging population. I'm not clear on how you're closing that gap, because aren't those people included in that number?
Good question.
Yeah, that's an excellent question. So a system like ours helps address some of that gap. I'm not going to claim that we can solve the entire problem, but there is latent capacity in our system of physicians and nurses and others that's just sitting on the sideline, and this is a way to more effectively get them in the game. But there have to be other things to help completely close that gap. Part of it is, like I said, telemedicine, some digital diagnostics and therapeutics. Some of it is also being smarter about which kinds of clinicians we use for which kinds of situations. So this is a multifactorial problem with a multifactorial solution. This is, I think, a big part of it. It'll solve a substantial percentage of it, but it won't solve the whole thing.
Any other quick comments or questions? Thank you, Alexi. Really good to have you here.